Hello, everybody. And we have a couple more sessions coming up from you as we close out the day. So please come in and join us. Come closer to the stage if you can. I mentioned earlier today that we love to break news here on the Devex stage, and we're about to do that in this next session. So I'm particularly excited about that. I want to go ahead and welcome our speakers to the stage as I set up this session and talk about this partnership. So we are joined by Keller Rinaudo Cliffton, the CEO of Zipline. Keller, come on up. We're also joined by Dr. Abdu Mukhtar, who's the National Coordinator for the Presidential Initiative for Unlocking the Healthcare Value Chain in Nigeria. Dr. Mukhtar, welcome. And finally, we're also joined by Marie-Ange Saraka-Yao, who's the Chief Resource Mobilization and Growth Officer at Gavi, the Vaccine Alliance. Thank you so much for joining us. So I mentioned we're breaking some news here. Oh, are you sharing a chair? Would you like me to scoot down one? Okay, this is partnership. I love it. We're going to get cozy here. So in this session, in partnership with Zipline and the Outcomes Accelerator, we're actually announcing a new partnership and exploring this partnership. And this really has the potential to revolutionize healthcare delivery in Nigeria. So I'll give the basics and then we'll go in further depth. But Nigeria has recently signed a memorandum of understanding with Zipline, which I know this well as someone who's covered tech for a long time for Devex, but if you don't know, Zipline is the global leader in autonomous drone technology. They will be expanding Nigeria's drone infrastructure nationwide and Zipline's drone infrastructure nationwide across Nigeria. And this is set to create the world's largest autonomous logistics system. So a number of organizations have come together to back this partnership. It aims to tackle some of Nigeria's most pressing health challenges. And we're going to talk about how this partnership came together and some of the emerging lessons. So to start, I want to hear from Keller. Again, Keller, it's really a pleasure to be seated next to you. I've followed Zipline's journey for a long time. And I wonder if you can tell us a bit more about this partnership with Nigeria. What impact do you hope it will have? And I know part of the transformative potential of drone delivery is what it can mean for rural areas. So tell us more about that.
Yeah, I mean, so, for those who aren't familiar, Zipline originally launched commercially in Rwanda in 2016, serving one hospital. Today, we serve 4,500 hospitals globally. We've flown about 95 million commercial autonomous miles. We serve about 45 million people. We deliver 75% of the national blood supply of multiple different countries fully autonomously. We've been able to reduce maternal mortality by about 51% across the hospitals we serve in several countries. We've delivered 20 million doses of vaccine. And as we expanded, people always said Nigeria would be the most important place to take this technology. And so about 2 years ago, we launched at a state level in Nigeria. Today, we operate 2 distribution centers in Kaduna, one in Bayelsa and one in Cross River. But especially when we started to see the work that the Nigerian government was doing, Tinubu's administration, Minister Pate, there are really exciting things afoot in Nigeria. There's this incredible vision to really transform healthcare nationally. It became clear to us that we wanted to be part of that national vision. And so that's why we're so excited about this announcement.
So you mentioned that Nigeria would be the critical place to bring this technology. I want to go to Dr. Mukhtar now and hear why is that? And can you expand on some of the unique challenges that Nigeria's healthcare system faces that perhaps Zipline is poised to help you address?
Okay. Look, thank you. Good afternoon. And since I'm talking on behalf of Nigeria, I will start by recognizing the presence of the Honorable Minister of State for Health for Nigeria, Dr. Tunji Alosa. Doctor, I think you're here, who is driving the agenda with his colleague, Dr. Pate, in Nigeria. And so look, what we're doing in Nigeria, we have a broad healthcare agenda that is anchored on 4 pillars. The first one is governance, ensuring accountability, transparency. The second one is addressing population health outcomes, reducing maternal mortality, child mortality, and disease burden in certain areas using, therapeutics and so on and so forth. And the third one is unlocking the healthcare value chain. And when we look at all of this, we're looking at solutions. And across all of these pillars, technology is actually one of the pillars that we are recognized as one of the key pillars. And when we look out there and see what Zipline is doing, in terms of logistics, whatever you want to do. So if you're reducing maternal mortality because you want to deliver blood and blood products faster, if you want to reduce child mortality because you want to deliver vaccines to rural areas, I think those are the kind of things that they're doing. And we feel that for us is addressing these challenges in primary healthcare delivery, in secondary healthcare delivery, and that is what we're trying to do with Zipline.
You often hear how the best kinds of partnerships between external partners and governments is obviously to align with the government's vision. So can you tell us, how does what Zipline delivers align with your vision? And let's talk kind of in the 5-year time frame. How does this align with your vision for the next 5 years?
So in 5 years' time, so when you look at the pillars that I've talked about, making sure that, you are able to bring about accountability in terms of supply of products, what Zipline is doing, just, using the technology and making sure you deliver, you will be able to reduce, wastage in, whatever it is, vaccines and therapeutics. You'll be able to be accountable, you know exactly what you're delivering, so you're able to reach more people. If you look at in terms of making sure, you deliver therapeutics, we have a very broad agenda for local production of healthcare products that we want to also be able to deliver. But if you look at also the structure of Nigeria, huge country, 230 million people, many places in the rural areas, so just using this technology that will be strategically located in places will actually bring about, improvement in many of these numbers. And we can go through, in terms of, you'll be able to save lives, you'll be able to help mothers who need blood transfusion in hospitals faster. You'll be able to reach, zero dose, children that are not vaccinated, that are not receiving the vaccinated because they're in difficult to reach areas, So really, for us in Nigeria, this partnership, and again, what Zipline is doing is we call it is like God sent, is the perfect solution.
Mm-hmm.
We're looking to do this, and I think it will help us. And we're very clear that the numbers that we are citing are actually very conservative. When we're done in 5 years' time, we think that the potential impact on ground for people, for citizens of Nigeria will be huge.
So I want to get into the mechanics of this partnership. I do think it holds lessons for others looking to do innovative global health partnerships. I want to come to Marie-Ange in a moment because Gavi is a seed funder of this partnership, which we'll talk about. But first, I have a question for Keller on the mechanics. So the Outcomes Accelerator and Total Impact Capital have been early supporters of this initiative, and it's part of a shared mission to mainstream outcomes-based approaches. So we hear that a lot. We hear this term. But can you elaborate on how Zipline's data platform allows for that kind of measurable outcomes partnership?
Yeah, I mean, look, I feel like sometimes my job as the entrepreneur is to be a little provocative. So
Please.
To be a little bit provocative, we've spent decades, like 100 years, having aid be primarily based on a structure of pay for actions. Mm-hmm. And it's really difficult, I think, to get the efficiency and agility and innovation that you want if you're paying for actions rather than paying for results. Mm-hmm. And so I do think that there is a big transformation coming that is largely going to be an exciting and really great thing where we're saying, look, like we need to start paying for performance and paying for results. And anybody who thinks that they can achieve results, whether it's a nonprofit company or a government actor or a for-profit, private entity, great. Who cares? We shouldn't discriminate. We should be driving to achieve results at the lowest price possible. And so I think that a lot of the work that we've done with those partners you mentioned is really setting up innovative new financing mechanisms to help partners throughout the global healthcare space figure out how they can start paying for results and performance rather than paying for actions. And again, this is how most of the global economy works. And so I think it's like kind of inevitable that we're going to have to figure out how to make this work. And I think the benefits, particularly for countries mm-hmm. and for patients, mm-hmm. are going to be huge if we can figure out how to do that.
And key to that in your model is this data platform. Like what Zipline delivers is not just drones, but you're tracking this performance.
Yeah, I mean, and so, last quick idea is that, the advantage of these kinds of autonomous systems, robotics, automation is that it is going to make systems way more transparent. Mm-hmm. You get a huge amount of data. You have a clear database. Every delivery, GPS coordinates, who is delivered to, exact timestamp. And making things, particularly like logistics systems, fully accountable and observable is going to be huge for ensuring that things get to where they need to go and reducing other kinds of problems we see in supply chains.
Just quickly, I want to get Dr. Mukhtar on this. In terms of results-based financing, which again, we hear all the time, why does that matter for you in a partnership like this one, that's core to the way the partnership is designed?
Yeah, look, there are so many challenges, right? I mean, there's so many ways where you can challenge your resources too. And we feel that when it's results-based, then is efficient, is based on specific business cases, is something that should be sustainable. We are not really relying on donor funding. Is not going to be long-term sustainable. And so it's a mix of multiple pots of money from the government, and we are going to put our money where our mouth is. Nigerian government is actually going to support this very strongly, put in resources, but it's also bringing potential partners on the donor side that you can mobilize. But the important thing is when you're seeing results. Mm-hmm. And again, when you're channeling public funds, you're also looking at the results. So if you're saving lives, if you are reducing wastage, if you are increasing the number of children that you need through immunization, if you are increasing delivering blood faster and therefore saving lives. So you can all tie those to specific results. And I think that's why it comes in. And so it's not just financing for financing's sake, but it's financing that is actually coming because it's well thought out, it's well planned, and is going to generate a sustainable model.
So Marie-Ange, I want to bring you into this because just as I have followed Zipline's growth for a long time, I've also followed Gavi's work with great interest, and especially Gavi's work to support innovation, including through Infuse, which you really helped to spearhead within Gavi. So you're on the lookout for innovations worth scaling. And as I mentioned, Gavi is a seed funder of this partnership. Why do you see this as an innovation worth scaling? And how does this partnership and your support of it align with Gavi's strategy?
Yes, I think Gavi has a true commitment to accelerating access, of course, of immunization to the kid, to the mother, to the end user, and we want really, and we have, spent some time focusing on doing that with cutting edge, scalable innovations like Zipline. So we started to partner with Zipline in 2016 in Rwanda. And now, of course, expanded to Ghana, Kenya, Nigeria, and want to do much more. And one, Côte d'Ivoire, of course.
Côte d'Ivoire, if you didn't know.
Sometimes you talk about your own country last. And of course, what we see in solutions like Zipline is that it allows us to break really the barriers that prevent us from really reaching that last mile, that kid or that mother that is on top of the mountain in Madagascar or in an underserved community somewhere. And through this partnership, talking about outcome, we have seen very, very quickly incredible results, in terms of, often you have a lot of missed opportunities. And now we are really dabbling on, actually reaching the people, having 24-hour service. You never heard about this before, and especially during the COVID-19, through in Ghana, for example, they were able to have 24/7 service. I know it's true here on the next door.
We take it for granted here.
Yes, but so I think this type of access is incredibly important. So we are extremely, extremely pleased to be announcing this partnership and this seed funding, with the government of Nigeria and Zipline. And of course, what's extraordinary is that we bring together a lot of our founders. Of course, we have the UK government that is matching up, this type of investment, and other private sector founders that are very important, UPS Foundation, ELMA, and others. So for us, it's really about scaling and bringing much faster the impact, and it's aligned very well. We just in June launched in Paris our next strategic cycle that is 5 years that will end in 2030. And there the idea is really, it took us 20 years to reach 1 billion children, to help immunize 1 billion children, we promised to do it in half the time. And so this acceleration in half the time can only happen with this type of, cutting edge technologies.
So we have very limited time left, so I'll go back to you for quick final words. But part of what's been so interesting about Zipline's journey and about this partnership is you have a range of stakeholders together, right? You have players from global health, you have governments, of course, but also the private sector. I know Zipline's attracted a lot of private investment over the years. What's a final message you want to leave this audience with, message, call to action, in terms of the kinds of partnership needed for more of these sorts of models to take hold? Again, very quickly, we're out of time, but I want to squeeze in a quick last word from each of you. So Keller, go ahead.
Yeah, I mean, two high-level thoughts. One is that through this partnership, Nigeria is going to become the largest commercial autonomous system on Earth, period. Bigger than the United States, bigger than Japan, bigger than Europe. So I think, what is exciting here is I don't think people have fully conceptualized what's possible, especially for countries that are willing to leapfrog into the future. We will be serving, we'll build 12 more distribution centers, and the plan is to serve half of the population of Nigeria, predominantly in rural areas. That's pretty exciting to me, and I think it's just scratching the surface of what's possible. And the second idea is something that actually President Kagame, Rwanda was the first country we launched in, something President Kagame told me like 6 years ago. He said, "Keller, you have no idea. We want trade, not aid, trade, not aid, trade, not aid." He was like, we are sick of parachute aid, people flying in, business class to put on a democracy seminar. What we need is foreign direct investment, technology, entrepreneurship, and jobs. We should listen to him. Mm-hmm. I think there is a really exciting transformation coming in this overall space. We have got to start listening. And I really hope that this partnership, bringing together, $1 billion of venture capital that Zipline's been able to raise, amazing partners in global health, visionary, government healthcare system, bringing together these partners to show what's possible. I really hope that others might choose to follow in these footsteps.
Given limited time, we may need to end on that, but I want to thank you all for taking the time to join us. Thank you to Zipline and the Outcomes Accelerator for your partnership on this session. And thank you for choosing Devex and this audience as the place to announce this partnership. We're excited to follow it. Thank you so much.
Thank you.
Thank you.